Hi, my name is Jason Nikoff, and I'm a professor of agronomy and soil science at Tennessee State University. This is the third module in my drone certification training, also known as Part 107 certification. And in this one, we're going to talk about physiological factors and risk management. So the first thing we're going to talk about is the effect of drugs and alcohol. So Part 107 prohibits a person from flying a drone or participating in any operations if they have consumed any alcoholic beverage in the last 8 hours, if they're under the influence of alcohol, if they have a blood alcohol concentration of 0.04 or greater, and if they are using a drug that affects mental or physical capabilities. Now, about 80% of aircraft accidents are caused by human error. So this is why the FAA is really interested in having people understand some of the effects of um, different things that can take place in their body and affect their ability to be a good pilot. And so we're gonna go through some of these different types of additional physiological or medical factors that relate to this. So the first one is a situation called hyperventilation, and this is where there is an excessive rate and depth of respiration leading to abnormal loss of carbon dioxide in the blood. The common symptoms include visual impairment, unconsciousness, lightheaded or dizzy sensation, tingling sensations, hot and cold sensations, and muscle spasms. And the way to overcome this is to slow the breathing rate, like breathing into a paper bag or talking aloud. And this can help overcome some of these effects. Also, we've got stress. Stress increases blood sugar, heart rate, respiration, blood pressure, and perspiration. Its acute form is related to an immediate threat that is perceived as danger, sort of the flight or fight response, and can develop into chronic stress. And so chronic stress presents an intolerable burden and causes individual performance to fall sharply. Unrelenting psychological pressures can create a cumulative effect, and so consulting a physician is a good idea if this sort of thing occurs. Next, we have fatigue, and fatigue can reduce attention and concentration. It can cause impaired coordination and decrease the ability to communicate. Acute fatigue may be caused by strenuous effort, excitement, or lack of sleep. It can affect timing and attention to peripheral vision. And then chronic fatigue may be caused by psychological issues or disease and causes feelings of weakness, tiredness, heart palpitations, breathlessness, headaches, irritability, or stomach and intestinal problems. Dehydration can be caused by hot temperatures, wind, humidity, and diuretic drinks like alcohol or caffeine. They can cause headaches, fatigue, cramps, sleepiness, and dizziness. And it can be prevented by drinking 2 to 4 quarts of water over a 24-hour period. Then we have heat stroke, which is the inability of the body to control its temperature. It has similar symptoms as dehydration, and the prevention is the same, drinking 2 to 4 quarts of water over a 24-hour period. Now we have kind of an acronym here called I am safe, and this encompasses all of the different physiological and medical factors that we discussed. So illness, medication, stress, alcohol, fatigue, and emotion. Now, situational awareness is important to be able to make sure that you are concentrating on the drone and the drone flight and you're not getting distracted. And so there is a scanning technique that's recommended. And so this is where you scan from left to right or right to left, starting at the greatest distance and moving closer with each scan. And you focus on 30-degree areas for 2 to 3 seconds each. And then those areas overlap by 10 degrees. So now nobody's going to be measuring this with a protractor or anything, but these are just kind of a good rule of thumb to keep in mind, essentially to keep yourself focused, to make sure that you're keeping your eyes on the sky of any sort of adverse situation that might occur, whether it's something that kind of comes out of the sky or the ground that can affect the drone itself, or that the drone can have an effect upon. Now, with aeronautical decision making, we can have two different types of resource management. We've got crew resource management, which is essentially when we have multiple people involved. And so you can see the definition there. We can also have what's called single pilot resource management, which, of course, as it sounds, is when we've only got the one pilot that's engaging in working with the different resources that are available. And then some things to keep in mind when it comes to risk management. You want to proactively identify safety-related hazards and mitigate the associated risks. You want to accept no unnecessary risk. You want to make risk decisions at the appropriate level. You only accept risk when the benefits outweigh the dangers. And then you want to integrate risk management in all stages of the flight. So now there are some different hazardous attitudes that folks need to be aware of. The first one is anti-authority. And the example is when somebody's, saying something like, "Don't tell me what to do." And the antidote to that is to follow the rules. Impulsivity. So you want to get out there and you want to do it quickly. Maybe there's a storm coming or there's something. And so you feel like you got to get it done really fast. But the antidote is to, not get so fast, to make sure that you're thinking and you're engaging in, the pre-flight checks and monitoring things and making sure that you're doing what you need to do. Invulnerability, the idea that, it won't happen to me. Well, of course, we all know Murphy's Law. And so a lot of times it definitely can happen. Macho attitude, where, I can do it better than you can. And the antidote to that is taking chances, remembering that taking chances is foolish. And then resignation, what's the use? So maybe you're in a situation where it seems like you're not going to be able to avoid, a crash or hitting something or whatever. But the antidote is, you're the one that's in control. You can make that difference and do everything you can to avoid any of those sort of hazardous situations. So this is another acronym. It's called the PAVE checklist. And this is focused on categories that you should be involved in pre-flight planning to assess your risk. And so taking into account the pilot, so we talked about all the physiological and medical factors that can affect the pilot, the aircraft, so of course doing pre-flight checks and those types of things that are required. Monitoring the environment, making sure that you understand what the weather's going to be like now and in the future. Also, any sort of restrictions that might be in the airspace, the situation, the if there's hills, valleys, what's near and what's around you. And then lastly, any sort of external pressures. And these pressures can relate to the pilot too. Things like emotional pressure or some of those hazardous attitudes that we already discussed. And then now we've got another acronym that focuses on steps that you should take when you're flying and to kind of keep some of these things in mind. And so there's the DECIDE model, which is detect, estimate, choose, identify, do, and evaluation. So detect, you want to detect that some change has occurred. You want to estimate the need to counter or react to that change. You want to choose a desirable outcome. You want to identify actions which would successfully control the change. You want to do it. You want to take that action, and then you want to evaluate the effect of that action in encountering the change that took place. And then the other model is called the 3P model. It's pretty similar to the DECIDE model, except it's shorter. It's perceive, process, and perform. And so again, it relates to, being able to identify any sort of hazards that are there and then determining what you need to do and then essentially doing it. I also want to talk about night flying because this is a newer portion of the exam that allow people, once they've gone through the exam, they can fly at night. Remember, of course, you need to have anti-collision lights that can be seen for at least 3 miles. But I'm going to talk a little bit about night flying as it relates to the exam. So obviously things are going to get a little different when we fly at night. Humans have more limited vision under low light or at night, which can affect our ability to see as well as we can during the daylight hours. So we've got rods and cones that are light sensitive nerves that help us to see in different ways. And so the cones can help us to see color. They can help us see details and faraway objects that are located in the center of the retina. And so on the right-hand side, you can see those cones being activated there in the daytime. And then in the nighttime, of course, that's where our blind spot is going to be. So we're not going to be as good at identifying color details or faraway objects. And so the size of the blind spot is going to increase as the distance between the object that you're looking at and your eye increases. Now, the rods in our eyes are used to see things out of the corner of our eye and can detect objects, particularly those that are moving, but it doesn't give detail or color. And those rods are arranged in a ring outside of the cones and provide our night vision. So you can see on the left-hand side, that is where our night vision is going to be best within those kind of outer portions of our vision. Now, since the rods are not located directly behind the pupil, off-center viewing is important during night vision. So, for example, if you've been outside and you've looked at a star that's kind of faint, you might not see it if you look directly at it. But if you look at it kind of out of the corner of your eye a little bit, you might see that it's there. But then when you look at it directly, it's gone again. And so that's kind of the idea where you don't necessarily want to focus on an object directly, but kind of monitor it, from the side of your vision. And so it's also important to engage a scanning procedure, like we talked about before. That scanning procedure can help to also identify certain objects that you might not see, and it'll help you to continue to monitor the situation. Now, when we go from a well-lit area into a dark room, it takes a while for the eyes to adjust. And so after about 5 to 10 minutes, the cones adjust to the change, and our eyes are about 100 times more sensitive. And then after about 30 minutes, the rods are going to adjust, and our eyes are about 100,000 times more sensitive than they were in the well-lit area. So therefore, it's a good idea to allow your eyes time to become adjusted to the dark and to try not to prevent or to try to prevent being exposed to any sort of bright white light for more than a second, as that's going to cause temporary blindness. And then, you're going to have to wait for your eyes to readjust again. If you do happen to be exposed to light while you're outside in the dark, try to close one eye, as some night vision will be retained in that eye that you close. And keep in mind that temporary blindness can cause illusions or after images until the eye recovers, which can cause you to misjudge or incorrectly identify objects. So those are all things that are really important to keep in mind when we're flying at night. And then we've also got some other things, some other sorts of illusions that are out there. And I've got them listed here with stationary lights, cloud cover, visual autokinesis, and flicker vertigo. And so on a clear night, distant stationary lights can be mistaken for stars or other aircraft. With cloud cover, cloud layers can actually create a false horizon. Visual autokinesis can occur when staring at a single light source for several seconds on a dark night, and the result is that the light appears to be moving. And this won't occur if the visual field is expanded through those scanning techniques that I mentioned. And then we've got flicker vertigo, and this can be caused by flickering lights such as those on the drone or the controller. And if this is continuous, it can cause nausea, dizziness, grogginess, unconsciousness, headaches, or confusion. So try as much as possible to avoid having lights that flicker. And then the last thing that I've got on this slide are the airplane position lights. And so these allow you to determine the direction of movement of other airplanes in flight. A red light is going to be positioned on the left wingtip, and a green light is going to be on the right wingtip, and then a white light is going to be found on the tail. So then that can help you identify, which direction it's moving, and those types of things. And then lastly, here's some other tips for night vision. Red light is good because it doesn't impair your night vision. So sometimes people will use a flashlight that's a red light flashlight. So that helps you to see some stuff, but it's not going to affect your night vision. Also, of course, don't wear sunglasses after sunset, as that's going to impair your night vision. Move your eyes more slowly than in the daytime. Blink your eyes if they become blurred. And then, of course, any sort of physiological or medical constraints are going to cause visual impairment as well. So that finishes things for this module. This is my contact information. If you've got any questions, please feel free to reach out to me. The next module is going to focus on weather.